student. Today I am here to discuss symptoms of performance anxiety with reference to counter stage fright, because in the previous lecture of mine I had defined what is a stage fright and various types of performance anxiety, because mostly I am using the term performance anxiety because this kind of fright is a part of anxiety. Then I also discussed phobia, various types of phobia related to this stage fright. But today I am going to discuss symptoms of performance anxiety and related to individual one. As I told you repeatedly that there are individual variations. If a person gets nervousness on the stage, it doesn't mean that the level of nervousness will be the same in other individual too. It depends on the nature and the personality of that individual. So, it is very important to discuss and to know some of the health issues also. Generally, we have this opinion that stage fear is a common thing. That is true, and it may happen to anybody or anywhere without thinking of the level and the intensity. But here I want to tell you that due to the health issue or due to the personality traits, well, this level of anxiety varies from person to person. So, it is very important to know this level of anxiety with personality traits and also health issue. So, performance anxiety, debilitating fear or worry when it is time to step up to the plate, that is a stage. The plate can be anything from giving a speech to finally making sweet. So, performance anxiety or stage fright is a sudden intense panic that occurs when you feel like you have to perform, and it differs from person to person. That is why the level of panic, any situation shrouded by pressure to achieve can lead to performance anxiety. Maybe it's the crowd chanting someone's name, God's name, master name, in the hope of winning something. That can also be level of panic. So, feeling panicked about standing up to speak or singing song or dancing in front of crowd, which shakes a person from within, is nothing but a stage fright. Of course, there are times we get called up to speak in public with no script, extempore, script or a stage inside. This performance anxiety can crop up before a class presentation, a board meeting, or even a wedding party. See, we teach first year student this stage performance not just to pass the examination or to get marks, rather to develop, to train a personality that can lead up to the final destination of the career. So, what is individual response if we talk of symptoms? Triggers and responses to anxiety disorders depend on individual experiences and the type of anxiety disorder a person has. Now, according to some medical practitioner, psychologist, therapist, psychiatrist, several examples of disorders are there. And what are these disorders? Generalized anxiety disorder. In short, it is GAD. Panic disorder, social anxiety disorder, phobias, separation anxiety disorder, agoraphobia. Some of the phobias I discussed in previous lecture of mine. Now, for instance, social anxiety disorder causes more psychological responses such as intense worrying, an irrational thought that something will happen if I have to catch the train, I will miss the train, unnecessary. In contrast, panic disorder causes more physical symptoms such as heart palpitation. Yes, sometimes it feels as if heart will come out. Palpitation is so high due to the fear, due to the anxiety. Now, there are other symptoms also related to this anxiety. Now, according to these medical practitioners, there are different types of anxiety disorders. So, symptoms depend on the individual and the type of anxiety they have. As I told you, that individual variations. However, all types of anxiety present several key symptoms, because we are discussing symptoms, stage fear symptoms and performance anxiety, and this is very helpful because before you lose the game, you better rectify yourself. So, what are these keys of symptoms? Emotional symptoms include feeling of anticipation. This is a kind of anxiety which is available in maximum people, especially the old age person. Emotional symptoms, anticipation, tenseness, irritability, dread, and headache, fatigueness, sweating, disturbed stomach functions. These are all part of emotional symptoms leading to stage fright or performance anxiety. Many people experience nervousness, jitters, and in some cases panic when expected to complete a task under pressure. Performance anxiety or stage fear or fright can prevent you from doing tasks such as giving a speech or presentation, meeting, interacting with your colleagues, your friends, your relatives in large crowd, groups, and perform even in personal relationship. There are many different types of performance anxiety, including social anxiety disorder and also personal performance anxiety. There is more popular, these are very, very common things. I won't say popular, but common things, even personal relation. And in fact, it affects 9.25% of men and 6 to 16% of women. So thankfully, there are plenty of methods to help you overcome your performance anxiety, but what is required? That you must know your personality trait. Remember, I told you in the beginning of my lecture that you introspect and try to know about yourself so that you can check yourself. If you are feeling nervous or apprehensive about a performance, know that you are not alone. Performance anxiety is a common issue that affects many people, but it doesn't have to control your life. Yes, with this idea, you have to move. The first quotation I shared with you, that before this particular aspect, that is a stage fright going to ruin your life, check it. So it can be common, but you need to check it, because you are not going to be controlled by these symptoms, but you are there to control such symptoms. Feeling nervous before an event or performance is a feeling that most people can relate to. Whether it is a sporting event, acting, public speaking, even the class performance, it is quite natural to experience such kind of, excitement, you can say, that lead to nervousness. But when these feelings start to impact your career and your life, quality of life, it's the time to seek help or to check. So, a stage fear or a stage fright, performance anxiety, is a set of emotions that can be beneficial up to a point, triggering a fight or flight response that prepare the body for potential danger, making us more alert and ready to respond. For many, these feelings will subside once the performance start or shortly after. Even I have seen in my teaching career that how students get nervous and sometimes even in panic also, faint also, such kind of thing. But for other, performance anxiety can be extremely limiting, stopping, preventing them from pursuing their passion or career. So if this happens, it is important to seek support to improve your quality. When you hear someone who is speak fluently, consistently, emphatically, clearly, you must be realizing that if you could speak like that. Now for that you need practice and also to check your quality. Now what are the symptoms that we generally dig out for improvement? And this is what I am discussing. The number of people who suffer from stage fear or performance anxiety is unknown, because don't know. Otherwise I am normal. The moment I come to the stage, I feel some kind of feeling that I cannot explain, maybe nervousness, maybe anxiety. So can be unknown, but we know it is a widespread issue and the victims are many, experiencing it at some point in their lives. So the amygdala, a part of the brain responsible for our fear function. Amygdala triggers a set of chemical reactions that release adrenaline, a kind of hormone. So, this results in a soaring throat rate, dry mouth, and other physical symptoms of performance anxiety. This I mentioned earlier also, including numbness, that is inactiveness, trembling hands and voice, sweating, feeling sick, a racing pulse and pouncing heart, tight throat and dry mouth. It is due to the amygdala releasing the hormone that is called adrenaline, and that makes you fear. Other common symptoms of performance anxiety include dreading the performance, worrying endlessly, and becoming withdrawn. Unfortunately, many people with performance anxiety do not seek help due to embarrassment or fear of public scrutiny. Some may resort to using drugs or alcohol to manage their symptom, but it is utterly wrong. Never do this. So, a stage fright or performance anxiety can strike any time you are the central focus of an event or performing. So, these are some situations where you may experience this kind of anxiety. Participating, I told you, raising your hand in the class, even then your heart palpitation will be very high. Playing a sport, playing music or performing dance. So many things where you can feel this. Almost anyone with performance anxiety will experience some physical symptoms, and this is because your body responds to the situation in the same way it would if you were being attacked. That is why the term is panic attack. The fight or flight mechanism kicks in and you feel as if you were in real danger. So, such symptoms make you shaky and sometimes even threatening to life, because racing pulse is not a good thing. Racing pulse can harm you. Tightening throat also, trembling, sweating, nausea and vision change, sometimes vomiting also. So, see, these are not good symptoms. So, one has to check it, because sometimes these are momentary in a particular moment when you are going to speak, but this should not happen, because you need to give your best. When you feel that when you are experiencing a sense of impending doom or panic, that you are lost, nothing is left, and when your heart rate increased, you are not in a position to think or to control. Also, trouble sleeping, not good sleep, and that will make you unable to concentrate. And before such presentation or any kind of performance, you need to take care of. Also, gastrointestinal problems such as nausea or vomiting, and sometimes dizziness too, because as I said that there are people who try to take alcohol or drug to avoid this. This is absolutely wrong. That may cause dizziness and that you may faint. So, these are all psychological, hormonal performance anxiety. with more severe performance anxiety, you may also experience intrusive psychological symptoms like a sense of mental numbness and dislocation, blackout, complete forgetfulness and memory slips, worrying for weeks, that is anxiety, worrying for weeks in advance of a performance, and that will make you, more weak. Full blown panic attacks at the mere thought of performing. So, see, that make you unable to perform. You are not working hard for the exam or the performance, rather thinking that you are going to fail because you are incapable. And this is the fact that instead of concentrating on the work to give the best, you concentrate on that hypothetical situation that you are going to lose. Performance anxiety, sometimes known as stage fright, is when you are so nervous. That is why I say stage fright and performance anxiety together, where you are unable to function well in a desirous manner, feeling nervous before singing like music performance or throwing a foul shot in sports is totally normal and not a cause for concern. However, if your nerves make it so that you physically can't function, it is worth discussing with a professional. Some people, both men and women, consider the physical activity also a part of anxiety, including that they either cannot perform or have no desire. This is the personal feeling. So, the anxiety you feel when presented with a challenge can manifest mentally, physically, or some combination of the two. Now, it is very important to know about the brain at this moment, because I told you that we all are different from each other. So, the amygdala, the part of brain, a collection of nuclei deep within the temporal lobe, the area of your brain near your ears, this part perceives emotions such as anger, fear and sadness. The amygdala also stores memories of events and emotions to help you to recognize what they are and why you are feeling them. People with anxiety disorder may have an overactive amygdala, which heightens their emotional response to certain situations. Environment is equally important or responsible. Some people develop anxiety disorder in response to an embarrassing, unpleasant or shameful experience. Now, for example, if you are singing in front of a crowd and they hoot you, you may feel so embarrassed that you develop anxiety about performing in front of others again, because that is there in your back of the mind. Similarly, if you have trouble getting anything in your personal life, that also may cause problem. So, brain structure, collection of nuclei, and that is responsible for so many things: sadness, emotional response to a situation. You know about this. Mental and psychiatric condition. I am telling you all these things because I need to tell you, as you may correct it in your life to achieve success. Mental and psychiatric condition can be challenging to diagnose. I have also seen students feel shy to go to, psychiatrist, because they have this feeling that people will consider them as mental case. It is not like that. Everyone has depression, everyone has anxiety, but yes, the level of anxiety, level of fear, that do matter. So a provider will usually discuss, like a therapist, doctors, psychologist, all these symptoms to assess for any underlying medical illness if the intensity is very high, and may use, maybe survey or some questioning to help quantify the symptoms of a person. So performance anxiety is not technically classified as a psychiatric condition. So there is no specific test or worksheet that can be used to diagnose this. So a provider, or sometime even you, can diagnose this by a history of your own symptoms. See, if I feel that, okay, this type of situation makes me fearful, I'll take note of that, I will take care of that whenever the situation occurs. So sometime you have to be careful of these things to rectify your situation and your mental condition. Know yourself. One of the very important aspect of stage fright and performance anxiety is know yourself. Knowing yourself is exactly about, neutralizing, minimizing all the psychological symptoms that are hampering your performance. Anticipatory anxiety, that is hypothetical thinking. Anticipatory anxiety refers to the feeling of fear that you experience before an event. While it is normal to feel a stress about future events, anticipatory anxiety involves an excessive worry about the future. So a certain degree of stress can be adaptive and very helpful to you while performing your best. So when this anxiety becomes severe, it can be debilitating, and this type of anxiety might cause you to become overly focused on adverse outcomes. It can also be all consuming and long lasting. So instead of feeling a little nervous right before an event, you might find yourself overwhelmed with feelings of worry and fear for weeks or months beforehand. While it might involve anxiety about upcoming events, it can also occur in response to everyday occurrence. Now, for example, you might experience anxiety while driving to work or catching the train, so that you may reach well on time. So anticipatory anxiety is not a distinct mental health condition. If you want to do things punctually, it is not a mental condition. But when you are obsessed for this, that becomes a mental condition, obsession. Instead, it is often a symptom of anxiety disorders. including social anxiety disorder, panic disorder, or generalized anxiety disorder. One way to deal with anticipatory anxiety is to try relabeling your emotions. Instead of calling your feelings nervousness or anxiety, it is better to work on reframing them as excitement and anticipation. For example, instead of saying I'm nervous, you would say I'm so excited. And this is what I say, the level of excitement. How much you are excited. Generalized anxiety is a chronic and exaggerated worry that occurs without having a specific source. And this type of anxiety is also sometimes referred to as free floating anxiety. So, people who experience this type of anxiety spend a lot of time worrying about a wide variety of future events. And such anxiety may center on health, social interactions, work relationship, and everyday events. So, if a person experiences excessive worry that interferes with essential areas of life and lasts most days for longer than 6 months, they may be diagnosed with generalized anxiety disorder, in short GAD. So, generalized anxiety disorder can be shown like always feeling on edge, always thinking of worst possible outcome in every situation, that is the negativity, fear, and inability to stop worrying, problems coping with uncertainty, problems concentrating, worries that are out of proportion to the actual danger. So, generalized anxiety tends to be twice as common in women as in men. Women tend to experience anxiety disorders at higher rates, so experts suggest that women and girls over the age of 13 should be screened during routine health examinations. And if you experience generalized anxiety, you should talk to primary health care provider or a mental health professionals. Nowadays, in every college, every institution, there is a center called wellness, having psychiatrist and mental trainer, all these. They can determine if your symptoms meet the generalized anxiety disorder diagnostic criteria. They can also recommend effective treatments, including psychotherapy and medications. So, student, I would like to stop here. Next time or in the next lecture, we shall discuss again some of the aspects of panic attack and the symptoms. Thank you very much.